Good afternoon, ladies and gentlemen. Thank you for virtually joining us for the Taiwan Smart Health Innovation Day. This event is hosted by the Small and Medium Enterprise Administration, Ministry of Economic Affairs, and executed by Taiwan-Japan SME Collaboration Platform. Also, thanks to TSI Japan for coordinate potential partners. My name is晋弘, and I will guide you through the process of today's event. The 47 pitches will be held in 3 sessions, with each startup giving an 8-minute innovation presentation. In the fields of smart medical, smart healthcare, and smart medical equipment, please stay with us for all the great talk. We hope this online event will bridge you to future partners. Thank you.
Now, please welcome the first startup, Medimaging Integrated Solution.
Hello, I'm Athena from Medimaging Integrated Solution. You can call us MIIS. And MIIS has been involved in design and manufacturing of digital handheld diagnostic scope that meet the highest quality standard in the world. And our core technologies are optical imaging system, digital images processing, and product manufacturing. As you can see, MIIS has acquired the following certificate like ISO 13485, GMP, FDA, and CE certificate. Therefore, we could sell our products to global customers. And we have our RA team could help to apply the certificate to speed up the progress. And we also have 2 factories for our products. One is in Taiwan for global market, and the other is located in China for China domestic market. And here is MIIS achievement and awards progress in the past 11 years. And we won Taiwan Excellent Gold Award of Fundus Camera in 2017 and Eye Anterior Camera in 2021. And here is our horoscope, total solution of our products. And for general lens, you can see we have the DSC100, DSC200P, and DSC300. And for eye care solution, we have DSC200 and DSC300. And you can, when you use our horoscope, you can swap the lens on the main board. And here is our 3rd generation scope. You can see we have a slit lamp called DEA200P. And for this light, you can see when you use horoscope products, the quality of the images meet clinical requirements. Our clinic test and IRB are work with the medical grade hospital like Cathay General Hospital and Tokyo Medical and Dental University. And here is our 3rd generation of our horoscope. For 3rd generation, we have improved our performance, like device-to-device solution to collect data of medical images and vital signs by Bluetooth connection. And the data also can send to the cloud platform to help physicians to diagnose in the short time. And we're not only building the hardware, also the software integration system. We have strong software team to do the technical development. For horoscope fundus camera, the accuracy is greater to 90% on AI diagnosis, diabetic retinopathy, and age-related macular degeneration. And we got the test result more than 5,000 patients. And here is our new products we call DIB100. And DIB100 could support the edge computing solution. And when we use fundus camera and through Bluetooth to import the data to the image box, enable internet to support real-time action. And DIB100 have 3 main features. First is mark the symptoms with different color to help physician to diagnose the diabetic fundus condition. And second is cybersecurity Wi-Fi connection. And the 3rd but not least is quick charging for the camera. Here I would like to share some samples successful cases in the world. And first is in Taiwan. We cooperate with Taidong County, and we took over 600 appointments in the first month. And second, you can see, second is in the United States. You can see the physicians show our horoscope package to the ex-president Mr. Trump. And the third is in France. You can see the nurse show our horoscope demoscope to Mr. Macron, the president in France. And here is our market state. You can see horoscope products sell over 60 countries, and our technical cooperate with the United States, Germany, and Japan. And thank you for your listening. I'm Athena Lien from MIIS, and please feel free to contact us if you are interested in our products. Have a nice day. Thank you.
MIIS is a medical imaging innovation solution provider. MIIS creates a user-friendly platform and the horoscope devices for all patients and doctors. We are committed to designing high-performance devices, developing diverse assistive accessories for mobile medical applications, and also integrating hardware with software to perform remote care. High performance. Horoscope Series 3 has 5 megapixel resolution with a multi-touch screen. Lightweight handheld size. Supports Wi-Fi and Bluetooth transmission. Live stream to HDMI sources from Horus device. Smart USB port lock provides a secure solution. With a magnetic charging cable, it's easy to use and super flexible. Horus 3 is designed for telemedicine, which develops the core concept of device-to-device communication. Each application has its own scope. Receiving the patient's overall record immediately provides more accurate and comprehensive diagnoses and treatment. We have another ophthalmology solution. The digital handheld non-midriatic camera set satisfies diverse users. More than ever before, it can provide a quality check after screening with high accuracy, supported by the video display on the device. Horus 3 with the digital image box supports edge computing for instant screening and marking of symptoms. Mobile medical. Horoscope has various types of assistive accessories. The portable luggage is designed for telemedicine and assembles products to one portable bag. We are determined to create a better and more convenient solution for the physician, getting rid of limitations and making telemedicine simpler and easier. Remote care. MIIS provides a total telemedicine solution. The horoscope integrates hardware and software to perform remote consultation, examination, and diagnostic services. Horus provides doctors the best diagnosis and treatment equipment. It is flipping medical space and time. Horoscope seizes the light, sees the future.
Soteria Biotech.
Hello, my name is晋弘. I'm the Medical Officer of Soteria Biotech. Thank you for having me here today. A brief information about Soteria Biotech. We were established in May 2016. We are a medical software developer, and we have been doing research in sleep apnea since 2008. We have also shared our research results in many conferences, including World Sleep Congress 2017. Since our medical software is regulated medical device, we have obtained ISO 13485 certification and Taiwan GMP in 2019, cleared Taiwan FDA, and CE marked our device in 2020. So what is sleep disordered breathing? Sleep disordered breathing is an abnormal breathing pattern or insufficient ventilation during sleep. It is caused by physical blockage of the airway by soft tissue surrounding the airway during sleep, as you can see from the diagram here. The most common SDB is obstructive sleep apnea, or OSA, which accounts for about 85% of all SDB. Why do we care about OSA? Because it is associated with many diseases, including high blood pressure, cardiovascular disease, diabetes, depression, stroke, memory loss, and even Alzheimer's disease. Children are also prone to have OSA. Studies have shown that as many as 15% of children have OSA, but 90% go undiagnosed. American Sleep Apnea Association suggests that as many as 25% of children diagnosed with ADHD may have symptoms of OSA and their learning difficulty and behavior problems due to the chronic fragmented sleep. In Japan, it is estimated that about 22 million adults have mild OSA, and about 9 million adults have moderate to severe OSA. The gold standard for diagnosing OSA is PSG, which is sleep study. As you can see on the diagram over here, patient needs to wear all these sensors to sleep at an unfamiliar place for about 6 to 8 hours, which is inconvenient and uncomfortable. Plus, the average waiting time for the study is about 1 to 3 months, which is slow and cumbersome process for both the patient and healthcare provider. Our solution expedites the diagnosing process by analyzing patients' upper airway CT or CBCT images, combining technology including medical imaging, computational fluid dynamics, big data, machine learning, and cloud computing. We were able to provide information, for example, airflow pressure and velocity within the airway, and assist doctors to evaluate whether a patient is having OSA. Currently, this solution is used in upper airway evaluation for both adults and children, customized oral appliance evaluation, health check, and it is especially useful for people who cannot take sleep study, such as people with physical disabilities. The procedure is very simple. All patient needs to do is to take the upper airway scan. The other steps are done by healthcare team, which include upload the images to Soteria OPZ, and when the report is ready, it will be delivered to the doctor. On the left over here, it is CBCT images without any analysis. As you can see, it is really difficult to tell if the airway is actually blocked or if it's normal. After our airway analysis with airflow pressure and velocity represented in different colors, it is much easier to see if the airway is obstructed and at which location. For example, look at the middle top diagram over here. The certain color change represents certain air pressure change, which means there is obstruction in that region. Over here. Look at the middle bottom diagram over here. There's no color change. Its uniformity represents there's no obstruction at all. Our advantages included its simple operation, fast analysis, and generation of report. More than 88% of accuracy when compared with gold standard, and it is quality assured. Our solution is also part of a grander OSA total solution, which takes care of patient from diagnosis to treatment suggestion and daily follow-up. Our solution is patented in Taiwan, US, China, Japan, and Singapore. Our certificates include GMP, ISO 13485, TFDA certificate, and CE mark. Thank you for your attention. We are currently looking for collaboration with CT, CBCT manufacturer, oral appliance manufacturer, hospital, sleep center, health check center, or agents.
Next, Open AI Fab.
Hi, this is Caroline from Open AI Fab. Open AI Fab is a startup company founded in May 2019. And our vision is in this ever-increasing demands on healthcare system, we can design AI solutions that can empower healthcare across different medical specialties from various organ systems, including the human minds. And what do we do? Okay, and we can offer medical AI solutions at different medical AI facilities at different hospital systems in Taiwan. And how can we achieve this? We work with doctors and other stakeholders to implement our solution through consultative engagement, where we can walk them through their clinical needs, scenarios, and pinpoint the pain points along their clinical and patient workflows, so we can ensure we deliver the most suitable AI solution. And thirdly, we are also undergoing product development process with further market research and building further product features along the customer journey, so we can enter clinical validation and license application with regulatory bodies. And what's our core strength? Our core strength is to address the pain points in the clinical practice by deliver our AI models with speed and accuracy. And we can do that through our R&D team's combined expertise and experience with open source AI model and AI solution development. We can quickly design the best roadmap to address customer needs with suitable model and train them effectively. And with our lean and multifunctional team and responsiveness to a customer, we can achieve that with accuracy. And secondly, we understand medical profession and data science are two highly specialized fields, and doctors are often very, very busy. So it's critical that our medical AI team can have a sufficient experience to communicate with extremely busy doctors. And what's our product positioning? Our positioning is we understand that when we need to provide medical AI solutions, we need to process data source from a different information system in the hospital. So we can be a good add-on enhancement to the clinical setting. So our goal is not only to have a medical AI solution, we will also like to develop into a final product such as SAMD, meaning software as medical device. And what's our key product portfolio? Mainly we have two lines. First is AI model with computer vision, image recognition with a semantic segmentation and proprietary model technology. So we can enable the process of dynamic image processing at medical setting. And our key portfolio is the left ventricle ejection fraction. And the application is for heart failure patients. And for this model, we have patents in progress and publication in progress as well. And secondly, we also have a natural language processing model. We can process data from medical charts. And for example, due to aging population and the hospitalized patient, they often have multiple disease that might also contribute to increasing risk for potential suicide. So we can detect such risk factors and have a warning system for the medical professionals managing inpatients. And what's our development strategy? First, when we first started out, we entered into individual medical departments at various hospitals. And within the first year, we have completed 5 to 10 medical AI solutions. And secondly, this is the stage we are at now. We would like to develop and further integrate our solution into a hospital information system and their platforms. And secondly, we are also preparing for FDA pre-submission for SMD. In the next stage, assuming to start from 2023, well, from a hospital system, we also like to develop into system-wide application. And secondly, we also like to achieve further regulatory milestones and approval for SMAD, and then also kick off our commercialization efforts. And for our target SMD market, the market is projected to grow rapidly from a currently projected close to $600 million in 2020 to $7.3 billion by 2027 at a staggering CAGR at 38%. And main reason such dramatic growth is mainly due to the increasing adoption of Internet of Things and connected devices in healthcare sector, and also the advantage of SM&D market. And our market entry strategy is that for this from this global market, we assume Taiwan would take 1% of the global market, and by 2027, we will assume to take 4% of the Taiwan market by entering into the key hospital systems. And for our competitive scenario, and while it is difficult to directly compare various players in this medical AI space, the aim here is to differentiate how we are different from other players here. And our key here is compared to other companies here, they can provide platforms to storing medical information and data, and also some basic AI disease model, and other company that provide a solution for mainly static medical imaging. We can provide solution not only for static, but also dynamic medical imaging, and also NLP solutions to include word and text information from medical charts. And and the second advantage is also we are preparing to go toward a medical device and to commercialize our AI solutions. And how can we achieve all this? Of course, the most important part of this is the team for a startup company such as ours. Our founder, CEO John, he has a 5-year experience in the Silicon Valley startup company. He also served as an AI advisor to our local association and a professor at the university. And also the team here, we have a AI team here with our CTO with over 10 years in AI development and combined experience from our AI team for over 20 years. And our management team also have a solid experience across medical sectors from medtech, pharma, and also medical device. And our pre-funding plan, our funding needs is estimated to be at $1 million. And the main goal here is to continue to expand our R&D team with 20 engineers. So in addition to AI engineer and data scientists, we also like to cover front and back end and UI UX design to complete the product development process. And such process will also be supported by our commercial efforts for further BD and marketing, and also regulatory efforts. Okay. So this will conclude my presentation for today. And if you have further interest in our company, please, you can look at our web and our FB website. Thank you.
instant nanobiosensor.
Hello, everyone. This is Tony Zhong, the CEO of Instant NanoBiosensors. We believe the light saves lives. About our company, we are the first in the world using light sensing. The light sensing, which is a combined optical fiber, nanotechnology, and microfluidic, which is our core technology, is the 4-per technology. Our stress is from the analysis from the life science to the diagnostic detection. So we have over 40 global patents, which distribute in UK, US, mainland China, and Taiwan. And now we have a leading publication, over 25 leading publications, and running with the 15 projects. Some great news I would like to share with you all. In the 2020, we've been selected from the over 500 global biotech company as a Merck strategic partner. We are the Asia only one company. Now we have one project still working with the Merck. And during these 2 years, there's many international media exposure. Just for you to know, we thank all the special interview from these all international media. And the most recently also report our update news in 2021. So the target and also the market that we focus, which is our biomarker. Biomarker is a biological molecule that found in our body fluid. So when we inject the vaccine, or we inject the antibody drug, or we do some diagnostic, all highly relate to the biomarkers, which is a highly growth market globally. But some of the existing problems that's then you to know, as we can see on the upper of the iceberg, they use the conventional ELISA assay as a traditional assay to analyze those biomarkers. But as we know, when we estimate that, we use the traditional way to estimate the iceberg, how deep it is and how wide it is. But actually, the iceberg, just what we can see, is truly deeply and also widely than what we estimate. So use the traditional ELISA or traditional method, which only can help us to detect and focus on the sick care, which is a leg disease. So we also need to go to the hospital to do the invasive diagnostic, or also need to have the hospital, this kind of centralization to do the diagnostic. But now we go to the new year, the cutting edge of the instant nanobiosensors, which can help the scientists and also the hospital clinician have more sensitivity, which is 1,000 times greater than the traditional assay. And also we have a wide range of the detection, which can help the first line of the clinician can get the result, and also can reach that decentralization, this kind of the trend, and approach the non-invasive and also the early diagnostic. You might ask, how does any existing solution doing this deeply and widely detection? Yes, there's a company, it's called Quantumness in US, which is the market cap is around $2 billion USD. They use just like a big refrigerator, this kind of a big machine. This is their CEO. As you can see, this machine is pretty with a highly performance, but the size is pretty big. So the Kevin during this JP Morgan, he mentioned about he's looking for a machine which is that with a decentralization performance, and also keep the ultra sensitivity and wide linear range, but also handling with a simple, easy. Now that's what the Kevin is looking for. But as we can looking inside their machine. Their machine has a two part. One is a full D system. The other is an optical design. for the 40 channels inside their big machine, there's a many complications like pumping, tubing, these kind of things. And also need to take care of those of the waste liquid things. And also in the other side, inside the machines also has many complicated optical things, which is just like laser or dichromy mirror. And there's a detection that need also the very complicated those kind of like an EMCCD. So which is the maintenance cost too high. But as you can see, our like a cutting edge technology, we combine the four-part technology, which use the optical fiber with a straight, like a very simple optical channels. So when the light pass through into and the signal react to those nano particle, as you can see, is a simple, easy detection. And also our fluid system, we just got these global patents with a low sample input and no pumping, no tubing, and then no waste, which is the high performance and instant and easy of use. And the comparison these two differentiation with the existing machine. The existing machine like a Quantenest or the other company is MSD, or the existing like ELISA automatic or manual process. They took a lot of the steps to do those experiments. But for us, we only need a couple steps, and within 15 minutes can have the high performance result. As you can see, we have a whole product line, which is a desktop and also the handheld device. They all use these our chip. Just if you can see my video, just like a chocolate chip. So within this chip can have a highly performance. Okay, these are all our customers. Our customers distribute in Europe, Taiwan, and Asia, and also in US, and also the Japan and the Korea. The strengths of our strategical plan is from the analysis from the left side and to focus on those antibody, drug and antibody antigen or vaccine, this kind of biomarker analysis. And we found the analysis and go to the diagnostic detection part. That's our strategic plan. And also from the life science, we use the ecosystem idea to combine the antibody company. Now we work with the big antibody company like Abcam, BioLegend, GeneTech, and these kind of big giant antibody company as our supplier, and also provide the channels. And for this part, and also we use the three of the major business model for distribute our product and clinical cooperation, and also go to the industrial value chain to have a more deeply cooperation. So this is our team. We believe light can save life. Thank you very much. Thank you.
Brain NAVI Biotechnology.
Hello, everybody. My name is Jerry Chen, the CEO of NanoRay Biotechnology. Today, we are introducing our new technique, how to combat COVID-19 with a robotic technique. And we are talking about our zero-contact medical station. This is our outline today. We are founded in 2015 in Taiwan, and we have about 30 people right now as our employees. And we have already got 20 patents received and another 31 keep on going. Originally, we are making a robot for brain surgery, but for the pandemic, we developed a new technique that is called the nasal swab robot and the zero contact medical station. Our core technology is a smart platform. We use the computer vision, the AI technology, and robot to make a real-time precision robot surgery for medical doctors to use during the surgery, and very accuracy and very safely. And this smart platform can be used in many places. First, we have a NowTrack, our autopilot neurosurgical navigation robot, and already got CE mark. And during the pandemic, we developed a nasal swab robot that doing the autonomous nasal swab robot to help medical doctors doing the risky task when sampling the patient. And in the future, we are going to focus on the top 10 cancers as an early treatment options. This is NowTrack, our first robots that doing the autonomous neurosurgical navigation robot. First, focus on brain. How to do that? We use the map. We use the medical images as a map, and we use the computer visions and sensors as the satellites. And use this technique, we can navigate the surgical robots to do the surgery. When we face the COVID-19, even we have already have a SARS 17 years ago, but we noticed that even after 17 years, we did not prepare enough. Our medical doctors still wearing the same PPE, wearing the same mask when facing this high-risk infection disease. So we developed the nasal swab robot to help medical doctors to do the risky task in daily life. And it has already been used in many hospitals here in Taiwan. And only the nasal swab robot is not enough. So we developed a zero contact medical station that combining the robots and also combining the environment control, that the nurses and doctors can stay in the control room and the patients stay in the testing room, and the testing room and control room were totally separated. And the airflow are controlled by the computer. So we provide a positive pressure in the control room and negative pressure for the testing room. So the aerosols won't come from the testing room to control room. So the medical doctors were always being protected. You don't even have to wear the PPE and mask. And we got a Taiwan's FDA approval for EUA use for the nasal swab robot. So we not only making a nasal swab robot, we provide a total solution of the zero contact medical station. So how it impacts the whole system? We can see that for the daily practice, that it takes about 4 to 8 hours to finish a PCR test. You have to do the swabbing outdoors and transport the sample into the lab and wearing the whole PPE to do the pipetting and then wait for 4 hours for the report. But with our technique, we can combine all these together. So you do the nasal swab pipetting and generate a report in one place. That is our medical station. And with our auto pipetting system, you don't have to waste another laboratory manpower. So only one nurses or doctors can finish the whole jobs. And it only takes 25 minutes to finish a PCR report. So this is the QR code. If you want to see the whole process, you can scan the QR code and finish and see the video. We know that for medical doctors, actually the most risky time is not doing the swab because you already wear the whole PPE. But another risky time is when you take off the PPE because you don't know where it's contaminated. So when you're taking off the PPE, somehow you get infected during that process. So if we can provide an environment that you don't even need a PPE, that would be much more safer than wearing the PPE itself. So for our medical station, we have some features. First, we will provide a very powerful ventilation cycles. So the testing room and control room will change the air about every minute. And after changing the air, and we will provide a UVC to sterilize the whole environment. Of course, we provide a positive pressure and negative pressure control, always computer. So we can always keep the pressure distance more than 16 pascal. So it will be much more safer. So of course, with the HEPA and UVC, all the air will be sterilized before it go into the air. So it not only protect the medical doctors and the patients, it also protect the environment. So we have a UVC and a fully automatic environment control system. And it is extendable and transportable, so it can be moved to anywhere when you need. So it's much more easy for a government to apply this kind of station to everywhere. And we know that somehow in the past time, you have to wear the whole PPE when taking a sample and doing the swab. And in the future, all these kind of risky tests will be done by a robot or auto machines. So it can be used in airports, some big factories or companies, or in some hospitals and even the military camps. So it will be very helpful in those areas that need a large-scale testing. And it is a proven technique. We have already used that in 18 hospitals here in Taiwan. And with the help of TSMC, we can provide this kind of technique to many, many places. Thank you for TSMC's support. So we deliver about 18 stations right now here in Taiwan in most of the medical centers and some middle-sized hospitals. This is a video that taken by one of our hospitals. They say that when it began the pandemic, they had to do the test in an extremely hot or extremely cold environment. So it's very, very difficult and very challenging. But with our device, with our station, the sampling can be done very safely with zero contact technique and very safe and very comfortable environment. And with the UVC and the environment control, they don't have to fear about getting infection by the patient. So they're much more comfortable and much more faster.
裁剪的工作，成为医护人员最坚强的后盾。谢谢您。谢谢。
So thank you for the listening of our presentation. So this is our presentation. So if you want to become our partnership, welcome to contact us. Thank you very much.
Next, BRAXX Biotech.
Hi everyone, I'm Wilson from BRAXX Biotech, and BRAXX Biotech is a company which develops a precise and innovative medical device for radiation therapy. And our company started from 2016. In 2019, we obtained FDA 510K and US-China patent. We also completed the clinical study. And this year, we have our foreign medical device manufacturer registered in Japan. Esophageal cancer is the 7th most common cancer with 6th most common cause of cancer-related death. And the 5-year survival rate is very low, only for 15%. Currently, 70% of patients choose EBRT treatment. It can cause lung cardiac damage up to 46% and is possibly died from serious complications. So now we have a therapy called brachytherapy. This is a relatively new therapy, which is through a catheter delivering radiation source directly inside of the body. Its high dose reduces the radiation damage to nearby normal tissue and improve cure rate. The past studies have shown that brachytherapy is effective in improving survival rates too. And so far, brachytherapy is not widely adopted clinically. There are 2 types of catheters in the market. One is NG tube, and the other one is special applicator. Both of them can cause some problems. NG tube cannot precisely position into esophagus, which causes uneven radiation, and the special applicator costs too much manpower and time-consuming. So we have our new esophageal applicator. The applicator is made by 8 balloons. Doctors insert the applicator through nose, inflating the balloons based on the location and the size of the tumor, which can improve positions and avoid hotspot damage. So far, we have done some experiments to compare the NG tube and our product. We published the result on Astron. This is the most renowned periodical of radiation therapy, showing that our device can reduce up to 6% of the hotspot dose. And there are several similar devices in the industry, one called Electa, the other called BIONIME. Both of these are transoral applicators, anesthesia needed, but which is not very sufficient. Our applicator are transnasal without anesthesia, which inflated balloons better position the location of the tumor in order to predict superiority in higher efficacy and less side effect. The patient of tolerance will be significantly improved. The clinical value of our new applicator is widely recognized from the hospital, physicians, and patients, improving a lot of efficiency. And so far, we have received positive feedbacks from most of the medical centers in Taiwan. And currently, we have over 20 times treatment performed without any anesthesia. For the market overview, we have the global number of the new cases is around 572,000 every year, and over 50% occurring in China. According to the real data we got, the biggest market is China with 2.2 billion market size, and the total addressable market is over $3 billion US. And in Taiwan, our product revenue, we have 9,300 patients with could generate $2.6 million US. And we count 2 sets for each treatment per patient with 10% market share. So it can cost $1.9 million product revenue every year. We have already obtained 510K and Taiwan FDA certificate, and we work on Japan and China government authentication. We have entire guarantee of patent portfolio from multiple countries, including China, Taiwan, Japan, USA, and South Korea. And our business model for our Taiwan market, we work with Simosa. This is our main distributor. And for foreign market, we have already contacted USA, Japan, China distributors as our strategy partners, and so far we already have some progress. And last Q4, we entered Japan market, and we accept to have our ISO 13485 certification and PDNA registration this year. And this is our main team. Our team members are from medical device management, clinical trial, radiation oncology, and medical device regulatory. So for our future prospect, we want to create a whole solution for esophageal cancer from diagnose and post-positive operative care. And we keep looking for business connection and clinical collaborations. And thank you very much.
Somnics.
Hi everyone, my name is晋弘, the VP of Somnics. Today I would like to introduce a new innovative device to treat obstructive sleep apnea, iNAV sleep therapy system. For Somnics, we are a medical device. We are focused on developing an innovative treatment solution for obstructive sleep apnea. And the iNAV today I would like to introduce is the only oral playthrough therapy for the OSA patient in the world. Invest on the R&D is our core value of Somnics. So we continue to put in the correct clinical data and applying the telemedicine to developing the technology of intraoral playthrough therapy. But what is obstructive sleep apnea? The OSA. OSA is a condition that people may stop breathing during sleep many times. And the main reason is that their upper airway is blocked by the soft tissue. The soft tissue may including the tongue and the palate. And the tongue and palate were falling down due to the gravity and the airway, then the airway blocked. So why it's so important to treat the obstructive sleep apnea? The obstructive sleep apnea is associated with many chronic diseases. It is, for example, the depression, type 2 diabetes, obesity, stroke, heart disease, and hypertension. And the most important thing is the obstructive sleep apnea is highly, the untreated obstructive sleep apnea will increase the risk of accidents due to the daytime sleepiness. OSA is a big market and undeveloped market. From the research of 2019, there are 55 million adults in the United States with obstructive sleep apnea. But what most important, surprising is more than 80% of the obstructive sleep apnea patients is undiagnosed. And the economic cost of the untreated OSA will be up to 150 billion. So this market is also grows very rapidly. So there are more and more people realize the obstructive sleep apnea is a public health problem. The government and insurance company, they are willing to pay for decreasing the health risk of OSA patients, and the CPAP, continuous pressure airway device, is our first line treatment solution. When people using the CPAP, they will wear a mask, and the mask will connect to a machine. The machine will deliver pressure into the upper airway of patient. And CPAP is an effective treatment solution. We could always increase the pressure of CPAP until the airway open. But there are many people cannot tolerate the pressure of CPAP. People may feel difficulty to breathe when they use, because of the false pressure. And when they're using the CPAP, they need to wear a mask and headgear on their face. It's very uncomfortable. And the CPAP machine is also bulky and not easy to travel. So a lot of people give up treatment when they are in traveling. So the truth is, there are many people suffering from the undiagnosed OSA. Even for those people have received their treatment CPAP, half of them will give up treatment after 1 year later. So it means a lot of people still have no ideal treatment choice. iNAV is a very easy to use device. It provides us opportunity by using the online D2C platform. Then we could target those CPAP rejectors. The efficacy of iNAV is proved by a strong clinical evidence, and iNAV allows the people to breathe naturally, and iNAV works without mask, and iNAV gives the patient a very comfortable and easy to use experience, and iNAV is also powered by a chargeable battery. And Somnics is also developing a cloud-based testing testing device and cloud platform to follow up the treatment outcome of iNav user. And it means the physician could manage or modify the treatment plan for their patient. And since the 2019, when we launched iNav, we have already received a lot of awards in the Taiwan and the worldwide. And the iNav, the safety and the efficacy of the iNav have already accepted by many countries. It includes the FDA 510K, CE mark, and Taiwan certificate. And there are also more and more certificates on the way. We believe iNav is the best choice for the CPAP rejector because compared to the dental device and surgery, the iNav is very easy to evaluate the treatment outcome, and iNav has no big side effect and risk. And most important things, iNav could let the people to try. So it's a very important thing. So because our company responds to the COVID-19, the safety and health of our customers and employees is our top priority. So we are developing an online platform to distribute the iNav and serve our customer in a non-contact way. So we're using the online D2C platform to provide our service. And it also gives us a highly scalable business model. So iNav is an innovative treatment solution for obstructive sleep apnea. So iNav could meet the needs of CPAP rejector. So when people using iNav, they can breathe by their nose naturally, and iNav has worked without mask, and iNav has a very comfortable interface. So iNav also could be charged by the battery. So it's land our patient could travel very easily. So Somnics hope iNav could enable the OSA patient to enjoy the natural breathing anytime and anywhere. So thank you for your listening. I hope you have sleep well and wherever you are.
MedFluid.
Good afternoon, everyone. I'm Bon Lee, the CEO and founder from MedFluid. So now I'm going to introduce you a little bit about MedFluid and what product we are promoting. So let's begin with a brief introduction about MedFluid. MedFluid was a medtech startup company in Taiwan, and we specialize in developing and designing IVD systems using patented laboratory techniques. Now, our product focus on the biomedical application of infectious disease to address the antimicrobial resistance issue. Since 2016, we have earned several awards and fundings based on our IVD products. Like we won National Innovation Awards in 2016, also Grand Prize in Innovate Pitch Contest at UTS Taipei in 2019. And recently, we also attended the CES 2021 as one of the 100 featured Taiwanese startups. So what makes us special? In fact, we have patented integrated membrane type microfluidic chip, which is capable of condensing entire IVD process, such as liquid handling and sample pretreatment in one single chip without manual operation. And with this core technique, the customized microfluidic chip is able to build up a precise liquid handling platform, and that is suitable to minimize the bulk of IVD's device and reduce reagent and labor costs. Due to overuse and misuse of antibiotics, the antimicrobial resistance is one of the major concerns in both human and animal health, since the bacteria is strongly resistant to both of commonly used antibiotics. That is very hard to treat. So now our product Nest is able to provide the precise results of antimicrobial susceptibility test, and well, we can show the precise quantitative results with a shortened incubation time. And its operation procedure is very simple. As long as we drop no more than 1 milliliter sample, and the liquid will auto-fill into each wells uniformly and mix with the preloaded antibiotics. And then the user can acquire the AST results after 4 to 10 hours incubation. Except for the single drug test, Nest also provides multi-drug version, which is able to conduct 40 antibiotic tests on cartridge. And also, we developed an automated device which can automate bacterial culture and result judgment. So the entire sales kit, including cartridges and automated device, is ready for sale in 2021 Q4. Now, for human, we are targeting spatial growth environment strains and small, medium-sized hospitals as our niche market. However, before we earned the regulatory with enough in vitro clinical trials, we are selling our products in animal market for the animal drug susceptibility test. So Nest has several advantages over other competitors. Like we can acquire quantitative AST results with short-term incubation, like 4 to 10 hours. And also easy to use for users due to the auto liquid filling design. And additionally, with our patented cartridges, the Nest can be used directly on a clinical specimen without further culturing. So compared to other similar products in the veterinary market, the NAST can greatly reduce the total cost and the laboratory. In laboratory, and we can also improve the sensitivities of tests and the feasibility of the test. So for demonstration of the AST cartridges, a standard strain like Staphylococcus aureus is used to validate the test performance with 12 drugs in one single chip. So after the introducing the sample into cartridge, the quantitative results generated from the device could provide doctors to prescribe the right dose and right antibiotic wisely, and to reduce the emergence of antibiotic resistance. We're gonna use reagent rental agreement as our revenue model. So we will provide automated device to the laboratory in hospital. And we also continue to sell the consumables like hospital cartridges, our main revenue. And MedFluid provide an automatic AST platform that can greatly reduce the human error and also the labor cost. And also, additionally, we also provide customized drug cartridges, which can make the doctor treat the bacterial infection more precisely. Here shows our business partners in Taiwan, as we are providing outsourcing and do product selling to veterinary hospitals. We are also accumulating the numbers of clinical trials, the regulatory earned in human market. So this is our roadmap currently. So after a quarter, we're gonna finish the mass production for cartridge, and also we launched the first generation NAST in veterinary market. And half year after that, we will finish preclinical regulatory. So after we submit enough validation data for regulatory, we will earn FDA, TFDA, PMDA cleared at 2022 Q4, and which means we can launch our product into the market. Meanwhile, we will launch our next generation product with high throughput AST device. So this diagram shows our business model. So we will sell our products like AST cartridge to clinics, and also our customized chip. We can ODM service to our business partners and primary users with also the customized chip and as well as the automated device. So now we are looking for the local distributor as our business partners, both in the veterinary market and human market. Also, we are doing fundraising for pre-A round. So now this is the end of our any questions or require information, welcome to contact us.
BIONIME.
Hello, everyone. Have a good day. My name is Wesley Yang. I'm a special assistant to CEO. Today, I will introduce the BIONIME and our new innovative medical device, the CGM, to everyone. Okay. BIONIME is a set up from the 2003. So we have two brands. One is a RightTest. The other is a GE Healthcare. We have authorized to use the GE logo to put on our glucose meter and strip from the 2012. And so we manufacture the GE glucose meter marketing and sales in the world from the 2012. And until now, we have 1,000 employees. Our vision is to create and provide a peace of mind mobile health solution to users. Our mission is a link to be a semi-closed loop between the BGMS, CGM, and the patch pump by RightTest Care AIoT system to realize an accurate, reliable, affordable, and user-friendly for the artificial pancreas. And our dream come true by the end of 2023. Till now, in the world, we have 7 subsidiaries and 2 offices for the global market products available in over 100 countries. Okay, so today I will introduce our continuous glucose monitoring system, CGM. Continuous glucose monitoring system is a lifestyle monitor. Is a much different from the BGMS. So the soft sensor of a CGM is implanted in the subcutaneous tissues of a human body. So the CGM, the data reading is made every minute automatically. It's also very different from the BGMS. So in one day, 24 hours, the data accumulated 1,440 times. And our CGM can 14 days wear in your bodies. Okay, we designed the inserter. The inserter is a stereo inserter pack, single use, and also preloaded with stereo sensors. With a pain-free movement is the same as Libre, and they user-friendly and ergonomically packaged. So, in the sensor inserted in the sensor onto your upper arm, adults for the upper arm or abdomen for the pediatrics. And we designed the sensor is a 14 days wear period, the same as Libre CGM, and measure the glucose every minute. Okay, you can see the demo by the photos. Our CGM is a factory pre-calibrated sensors. We have 3 features and advantage. One is no user calibration required. The second is with the calibration option and 2 hours warm-up period. Okay, we also designed the transmitter. The transmitter is separate from the sensor. The design is the same as Dexcom G6. The transmitter can calculate the glucose values and work externally on top of the sensor, secure to the sensor with a click-in the mechanism and the data transmission every minute. So our transmitter have 2 options. One is a single use, the same as app Libre. The second is can be multiple use. the same as the Discom, the rechargeable transmitter, but our transmitter can be used 2 years. It's a longer than the Discom G6, and the powerful capacity and storage can last 14 days, and with a little data loss, and the distance can up to the 6 meters to transmission the data from the transmitter to the egg. Also, our transmitter is water resistance. The level up to the IPS7. Okay, so the transmitter is thinner and lighter and less obstructive compared with the Discom G6 or G5. We also design our egg only for the CGM. So some advantage, including the visual, vibratory, and audio alerts, are on a handheld device. Okay, so we use the Bluetooth technology, transmit the data from the CGM to the app. The app can be downloaded by mobile phone from the Google Play and the App Store. Okay, this is a competition analysis. So our CGM have two specs. One is a HM312. The other is a HM322. One is a single use of the transmitter. The other you can reuse the transmitter. The antenna is all the GOD, and the measuring range is from the 40 to 500 in real time. And the sensor length is only 5 millimeter, smaller than the Discom sensor, and the same as the Libre 2, and also smaller than the Medtronic sensor. And the value is also smaller than the Libre 2, and the weight is only 4.2 grams. So this is a very usable to the child or the adolescents, and the duration is 14 days. Warm up is 2 hours. The key important feature and advantage is that we are factory pre-calibrated, but you also can use the calibration by BGM, depending on your choice. Okay. And glucose trend, yes, we have glucose trend alert, alarm, and also have a share report with the family and the doctor design in our app. So displayed by smartphone or receiver. Okay, this is our new medical device CGM introduction. Thank you. Thank you.
Thank you for your attention. The first session of presentation has come to the end. Please take a break, and the next session will start after 10 minutes. Stay tuned. back to Taiwan Smart Health Innovation Day. Our second session of presentation is about to start. Now, let's welcome the next startup, Apollo Medical Optics.
Hello, everyone. My name is David Ma. I'm the CEO of Apollo Medical Optics. We are a medtech company based in Taiwan, focusing on developing high-end optical coherent tomography technology. Our mission is to bring the breakthrough development of non-invasive visualization medical technology to the world. Let me quickly introduce you what is OCT. So basically, OCT technology, simply understand it, is that we shine light to an object and we collect the reflective light. And by analyzing those reflecting light, we can do the 1D, 2D, or 3D formation. So we can see the structure and information underneath of the measured surface. And the first application of our technology is to apply to dermatological applications. And we know skin cancer is the most common cancer in the United States, Europe, and Australia. And the WHO data shows that skin cancer is one of the most severe cancer on earth. In the United States alone, there are about 5 million new incidents every year. So we know it's a very severe problem globally. So current situation is that dermatologists, they use their naked eye or they use a magnifier, also known as dermoscopy, to see the color lesion of the suspected area. So once they know or they suspected that lesion is a skin cancer, they have to do a skin biopsy. So skin biopsy basically is just remove a piece of your meat out of the patient's, of the suspected area. And this whole process is a really time consuming and also costs a lot of money. Like in the United States alone, there are about $3 billion spent on skin biopsy. So is there a way more effectively help dermatologists to make a clinical judgment without doing biopsy? Because the biopsy number and patient number is so great in the United States and around the globe. So let me show you an example. So on the right-hand side is a malignant skin cancer. It's called lentigo maligna. And on the right-hand side is a benign tumor. It's called LCA, large cell carcinoma. And on the left-hand side is a bad skin cancer called lentigo maligna. It's a bad and really severe skin cancer type. So based on the surface colors, it's very difficult to differentiate the benign tumor versus malignant tumors. Okay, it's all brownish. It has some web structure. It's difficult to tell. However, when you do the biopsy, you can see the structure on the right-hand side. It has some pigmented and also elongated epidermis area. And however, on the left-hand side, the malignant tumor, the structure is totally different from the benign tumor. By saying that, first of all, you still have to do biopsy. But again, biopsy takes time and spend money. And we work with the best dermatologists in Taiwan. And by using our OCT system, we can clearly see the cellular structure underneath the surface of the skin. So we compare our OCT images to the histology biopsy images. We can see it's highly comparable. So with our system, the doctors, they don't need to do biopsy to do a quick screen of the suspected color lesion. They can use our system, quickly gain cellular information of the patient so they can make their medical decision more effectively and more efficiently. Furthermore, with our high resolution or cellular resolution OCT system. We can use our AI algorithm to mark the intracellular structure or cellular information, such as the position of melanin, and also known the location and the normality of the nucleus. And we can map out the dermis-epidermis junction, and those are the key information for dermatologists making clinical judgments. And we have generated our first commercial system, ApolloView S100. And this ApolloView S100, we can not only provide the cross-sectional images, but we can also provide the lateral for doctors gain more information underneath the surface of the skin. If they want, they can also generate a 3D scanning of the system. And this overall information can provide much greater value for dermatologists, better than just using naked eye or dermoscopy. Again, as I mentioned before, we work with the best dermatologists in Taiwan. We have followed up several skin cancer patients, and current data we have been published in a well-known journal. It demonstrates that our OCT system, the image quality is highly comparable to the histological result. So the dermatologists, they can learn our system really relatively fast, and they can accept our system relatively easier in their daily practice. And the reason why we are very competitive of our OCT system is because we have a broadband light source, and this is an international patent protected core technology of AMO. Because of that, we can generate much higher quality OCT images and much higher cellular resolution OCT images compared to other international competitors. Another interesting area that is also can use our system to generate value is the aesthetic market, aesthetic application. We know the resurfacing laser and whitening laser sales grows every year, double digit. And the reason, and one main reason for whitening is that the people want to have a better skin care, better skin health, and also better look. And why people have color on their skin is because the melanin has different density, and also they locate at a different position underneath of the surface of the skin. So in order to more precise locate the melanin position, we can use our system to locate the melanin position. And the doctors can see our images and use the right laser to do the treatment. So that's why our aesthetic application is also very attractive. And our international expansion plan is to work with the KOLs and medical center globally in the United States, Europe, and Taiwan. And later on, we will participate in international dermatology community. And we also identify key distributor in the United States, Germany, and also in China. And we have been supported with several investors in Taiwan, and we are very lucky to gain US certification and Taiwanese certification in the last year. And we have a very professional team in business and also technology development, and also international medical consultation help us to do the medical application more precisely, accurately. And we are seeking strategic investors and also medical device channel and distributor, also aesthetic device distributor. So we are very likely to find Japanese distributor or collaborators. Thank you very much. I'm David Ma from AMO. Thank you.
Next, NanoRay Biotech.
Hello, my name is Mike Su, and I'll be presenting NanoRay Biotech Company. NanoRay was established in 2007 to research and develop our patented transmission X-ray. We are the only company to have applied enclosed transmission X-ray technology in the areas of medical imaging systems, molecular therapy, and non-destructive testing. Our core technology is our patented transmission X-ray. This principle of penetrating X-ray tube is shown in the figure on the right. NanoRay's application in cancer therapy is shown on the picture on the left. We use a selected metal target that can generate 33 keV in a single energy spectrum, which is different from the traditional tungsten target spectrum, thus producing a higher probability of larger electron when combined with specific drugs. Our core transmission X-ray uses less energy to generate less radiation with a wider angle of exposure, all the while maintaining quality image comparable to traditional X-ray. Because of this transparent light emitting mechanism and structural design, it has a technical advantage of having a wide light angle of more than 130 degrees compared to the traditional reflective X-ray tube, which has a maximum light emitting angle of 60 degrees. Because of this, our wide angle irradiation distance can be shortened to less than half, which can greatly reduce the size of our equipment. Finally, in view of desire for high image contrast on composite material, NanoRay has also developed a single-shot dual energy or multi-energy X-ray tube, which is a global exclusive technology. We also have patents in China, US, Japan, Taiwan for both the X-ray tube and the cancer therapy. NanoRay develops and manufactures transmission X-ray tubes. Using our core technology, we assemble these tubes into modules. Then using these modules to develop medical imaging products and cancer therapy systems for the medical industry, and also for quality control systems in the production line for the industrial market. Medical imaging systems. In MIS, we are targeting in areas of medical imaging where our transmission X-ray holds a key advantage in low-dose radiation exposure. This includes bone age assessments, pediatric transmission X-ray, and low-dose mammography. We are currently developing a desktop imaging system to take the bone age assessment from the big hospital X-ray room to the local clinic where our product, with our product called Revolux. We are currently planning 510K filing by the end of September. Bone age. We've developed our Revolux system partnering with Innolux Care and Everfortune AI to provide bone age assessments that will take traditional methods of obtaining skeletal image from the big hospital to the local clinic. Revolux Bone Age system is cooperating with Everfortune AI for clinical assessments in Taiwan and with 16-bit in North America and bone experts in Europe. In traditional methods of obtaining bone age skeletal maturity X-ray image, an adolescent will go to the hospital, see their doctor, and get their left hand X-ray. Then the doctor will get this X-ray image and spend roughly about 6 to 10 minutes observing and analyzing this X-ray image to determine this individual's skeletal age. Without Revolux Bone Age system, doctors don't have to spend any amount of time analyzing. That job is given to the FDA-approved AI software to determine bone age as a result. And within 1 minute, this individual's skeletal maturity report is available. In addition, Revolux is portable, safe to transport, and can be used in any environment. But our biggest advantage is that the transmission X-ray tube radiation dose is 1/6 that of traditional X-ray. Image quality and dose reduction. We've had third-party assess that our transmission X-ray dose does reduce radiation exposure between 40 to 60% of comparable image quality. Auger molecular therapy. This is a cancer therapy developed using our patented transmission X-ray that generates characteristic radiation to trigger Auger effect when combined with a heavy atom-based drug. This novel approach to cancer therapy has been published in ACR 2019, where we show the effectiveness of our characteristic X-ray photon to emit heavy atom as Auger emitter, releasing a chain effect resulting in damaging tumor cells' DNA chain while avoiding nearby normal cell damages. We are currently in the final stages of completing our IND submission, and we foresee entering phase 1 clinical trials by the second quarter of 2022. Our phase 1 clinical trial indication is malignant cutaneous lesion, developed in the late stages of cancer where the tumor has infiltrated the skin surface, forming an open wound in which the wound interferes with the patient's quality of life. This palliative treatment frequently uses radiation therapy applied for local control and to improve the patient's quality of life. We are also currently doing basic research on how we can apply Auger molecular therapy on ocular melanoma. Conventional therapy has adverse effect on the retina and optical nerves. Our transmission X-ray at its current setup have an average penetration of 1.6 centimeter, while the average adult eyeball diameter is 2.3 centimeters. That means that our radiotherapy can be applied to the eye with minimal, if any, adverse effect on the retina and the optical nerves. Professor Fuyuhiko Tamano of Kyoto University Institute for Integrated Cells Material Science has also found interest in our transmission X-ray. In his research with nanoparticle in combination with monochromatic X-ray to induce Auger effect for cancer therapy. In his current research, he's using the synchrotron radiation, which cannot be translated to clinical use. We believe that our AMT treatment in conjunction with immunotherapy could present new options in cancer therapy. For NDT, non-destructive testing, we've developed it into several products to meet the needs of non-destructive testing area. This can be a wide range of products of quality control using X-ray in academia to semiconductor, food safety to biomedical, pharmaceutical industry. Products such as laboratory imaging equipment, battery inspection system for use in the manufacturing of batteries, or for the pharmaceutical industry in quality control for the manufacturing of lyophilized vial inspections. We are currently seeking strategic partners and investors to co-develop future products and international channels cooperations. Thank you for your attention.
Next, APrevent Medical.
Hello, I'm Mark from APrevent. I'm going to share how we have been revolutionizing the solutions for patients with motor speech disorders. For most of us, we take our ability to communicate with our own speeches for granted. This is how we talk to others and also how we share our feelings with our friends and families. And also in recent decades, it's a large part of how we interact with technology. But for millions around the world, this sense of capability has been lost. It's about 1.7% of the people that suffer from moderate to severe motor speech disorders. It is about 400,000 of people in Taiwan and more than about 2 million people in Japan. These people, they cannot use their own speeches to communicate with others. Most of the motor speech disorders are caused by neurological disease like stroke, Parkinson's, CP, or ALS. It results in communication barriers. They are not able to express their thoughts or even express their needs to others. And it causes social isolation, frustration, negative emotions, and a lot of problems. It also causes a lot of burdens to their family members. So even though these patients, their mind are fully functioning, they know what they actually want to say, but people just don't understand what they said. Now they can only rely on limited options from SGDs, the speech generating devices, to communicate with others. For example, if they need a glass of water, they might type water, or they need to find the icon on the screen and then push it. However, these devices are very, very difficult for them to operate because most of these patients are also comes with physical disables. So many of us believe the future is the digital speeches translated through the automated speech recognition, or we call it ASR. However, there are many challenges to make that possible. The current ASR are based on the technology like Google, Siri, or Alexa from Amazon. They does not recognize accurately interpret patients with speech disorders because these speech databases was based on the normal speakers. So from 2017, APrevent started to collaborate with major hospitals in Taiwan and in the United States, and we have developed thousands of minutes of digital speeches in Mandarin Chinese and in English. And we continue to develop these databases after our solutions are in the market. This big data is fed into our AI machine learning, and we let the machine to learn what are the differences of the acoustic feature between the digital speeches and the normal speeches. And we also collaborate with several modern language processing models to increase the accuracy. Our AI speak technologies can be replicated to other languages easily, like Japanese, just using the same machine learning model. And with more global hospital relationship to collect big data, we can push our other language quickly in the future. So we actually are able to develop our AI models that interpret the digital speech with very good promising accuracy. From the slide, you can see this is an example from moderate digital speakers. The current ASR, like Google and Siri, based on the normal speech database, can only recognize about 10% of the words. But with our own APrevent big database, we increase the recognition accuracy rate from about 10% to 55%. The performance can be improved significantly after 2 of our in-house technologies are included: the personal transfer learning and the synthesized data augmentation. We are going to release our Mandarin Chinese version of AI Speak Messenger next year. This product is like a translator. Through smart devices like smartphone, the patients can much easier to talk to or to text to others using their own speeches. And our next steps, the AI Speak device with special design chip will be more portable and can be covered by health reimbursement. And currently, we are already achieved a great feedback on our first generation solution. We call it AI Speak Portal. This is available at Google Play Store now. The patients can easily use common syllables like vowels, like A-E-R-O-U. And then these sounds are actually very easy for the people with speech disorders to pronounce. Using these vowels, they can easily to control over the computer, like watching the YouTube, listen to radio, or talk to Siri to control the home appliance. And with our special UI and UX design, they can also use the common syllables to talk or text to others. The AirSpeak is not just an app or a device. Actually, we believe it's a technology platform. And we are looking for collaborations with healthcare providers, IoT, 5G network, and hardware or software providers to discover the abundance of its applications. Just a brief about our company. APrevent is founded by clinical experienced physicians and engineers. The CEO, Dr. Floyd Ho, received his MD and PhD degree from the medical school in University of Vienna. And I received my PhD degree from the engineering school in University of Michigan in Ann Arbor. APrevent is dedicated to providing minimal invasive and innovative ENT solutions for voice and speech disorders. And our another solution, voice, is a long-term laryngeal implant to treat glottic insufficiency. Thank you for your attention, and it's a wonderful opportunity to share our innovations with you. Please feel free to contact us if you have any questions or looking for collaborations. Thank you.
Next, TaiHao Medical.
Good day, everyone. My name is Jenny, Finance Accounting Manager from TaiHao Medical. Today, I want to introduce how our company and products help saving more lives by accurately detecting. TaiHao Medical is an AI company designing and developing medical software to help healthcare providers manage the increasing workload. We focus on breast screening and diagnosis solutions for ultrasound and low-dose CT AI solutions. So, why are these important for human beings? Let's see the next slide. This is the report from WHO. We could see that the lung cancer and the breast cancer are top 3 people have been confirmed. About the lung cancer, the mortality rate is the highest among major cancers. About the breast cancer, incidence in females happen in whole world. Japan is the highest in Asian countries. 1 in 9 women will be diagnosed with breast cancer in their life. Next, the current problem women meet is dense breast. Dense breast will lead to higher risk getting the cancer. If you go to the hospital for health check, the most common breast cancer detection is mammography, which means using X-ray. However, if we only use X-ray, women who have dense breasts are not easily be detected by mammography. It will lead to false positives. False positives will lead to greater in danger of late treatment and death. Because of this problem, breast density notification laws have been passed by 38 states in the United States. When the doctors find that the female breast is dense breast, it is necessary to inform the patient that ultrasound examination is required. On the other hand, JSTARS, a famous organization in Japan, also promotes ultrasound breast screening. This is the information from them. If we only use mammography, only 77% will be confirmed in right results. But if we use mammography and ultrasound, the sensitivity rate will raise. It means it will reduce false positive problems. As a result, there are more hospitals or people who choosing ultrasound. You could see the yellow line. It grows fast and even surpassed by mammography by every year. Moreover, due to aging population and reliance on technology, growth in imaging performance is much faster than training the new radiologists. To conclude, this is what we're doing to solve these problems. Early detection and early treatment can have better life. Our product, exactly AI software, can enhance effectiveness and efficiency to assist doctors to make more complete and precise decisions. Let's see our published product, which got FDA approval. BR-View Smart System and BR Viewer. The right side is BR Viewer. It's 3D, ultrasonic, automatic, image processing system. It can produce the report in different languages. Doctors can see the suspicious point first to save more time. It's suitable for Siemens, GE, and other Airbus automatic ultrasound device. The left side is Smart System. This product can enhance scanning quality. And it also got Japan PMDA approval. First, it is suitable for current ultrasonic devices. Second, it will record the whole process to ensure whether doctors miss or repeat scanning. Third, Smart System can reveal the position of the probe and the distance from the nipple. Last but not the least, it can detect the suspicious area in real time. Here are our pictures and YouTube for further introduction. We have cooperated with Taiwan big hospitals and global medical device platforms to promote our products. We look forward to increasing usage rates to help more people. Keep going on. Here are our developed products now is in clinical trial. The amazing point is that BioCAD and TLong can analyze and classify the lesions or nodules through images in a well-organized way. Doctors still can modify the report if they think it's needy. We believe this improvement can lead to greater medical quality. To conclude, our AI software will be star products in these potential markets. We have strong technical team in related areas. All of them are experienced and professional. As I mentioned at the beginning, early detection, early treatment, most lives saved is TaiHao's value proposition. This is not just a slogan. We do clinical trial in the US and Japan. We applied for FDA approval and got more than 10 patents from Taiwan, United States, Japan, and China. For today's conference, let me emphasize on PMDA Japan at the bottom of the middle. This is an important approval. We can sell our products in Japan. All of them are our core values. We aim to be one of the most successful AI medical companies. So, what else did we do? We integrate with AI marketplace. We cooperate with government screening program, women breast center, mammography clinics, insurance company, and ultrasound machine manufacturers. We are seeking investors to invest our company as well. In fact, R&D cost is high, but it's a must. Funds will be used for marketing, R&D, and clinical trial. If you are interested in our company, here is our contact information. We are welcome to attract people or corporations with same vision. We, together, make this dream come true. Thank you.
Astron Medtech.
Hello, this is Ben from Astron Medtech. We're a company dedicated ourselves to develop a minimal invasive solutions for orthopedic injuries. Let's take Santi Cazorla for example. He's a national football player in Spain. He suffered from Achilles tendon rupture in 2016, and he conducted 8 operations in 2 years due to Achilles tendon post-operative infections, and he missed 160 games because of that. And why was that? It's because the traditional surgery for Achilles tendon and for tendon, it's an open surgery. And this open surgery creates such a long incisions. It's a 10 to 15 centimeters incision that causes a high complication rate. And with these complications, hospital has to pay extra money just for the treatments for their infections. And for the patient have to have a longer recovery times, and it's difficult for them to work and exercise within the 6 months. So this is a big and huge problem for people who suffer from tendon ruptures. Therefore, we provided a precisional minimal invasive suture system for tendon repair. This system includes one ultrasonic guidance system and devices, grasper devices. It's a disposable kit that helps the patients to conduct a minimal invasive surgeries. And this disposable kit includes suture anchor, grasper, suture holders. And with these devices, we'll be able to apply on multiple indications. For example, Achilles tendon rupture and rotator cuff ruptures. And how does the procedure look like? It's actually fairly simple. First of all, we're using the ultrasound guidance to see the rupture sites, just like the picture that we see. There's a black hole. And then we're using the needle and then using the graspers to penetrate the tendon and open a 1 centimeter of incisions and using the grasper to retrieve the suture. And with that, we'll be able to tie both of the suture together and complete the suture and the surgeries. Therefore, with these solutions, we'll be able to create the smallest incision in the world. And we can reduce the incision from 15 centimeters to only 1 centimeter, like the picture below. And therefore, we can reduce the complication rate from 15% to only 1%, which help the patients to reduce their inpatient times in the hospital by 33%, and helping the patients to reduce the rehab time from 6 months to 4 months, and helping them to save $1,280 per treatment. And this technology has been published in 3 clinical papers. And in this year, we received a national award on this technology. What's more, there's more than 10 surgeons have learned these techniques, including NTU Hospital, Tsuji Hospital, and Shouchuan hospitals. And there is more than 100 clinical tests validated based on this technology. And this year, we conduct more than 20 usability tests with physicians from all over the Taiwan. And all of the feedbacks are positive, and they are all looking forward to using this products. In terms of the competitor analysis, compared to the competitor under the same CPT code, unlike BRAXX, the jig systems, and Zimmer, the patch systems, we create the smallest incisions, which is only 0.8, and we create the lowest recovery time, which is only 4 months. More importantly, we'll be able to help the patients preventing sure nerve damage, and this is what our competitor will not be able to conduct. Our market focusing on the US market and the Japan market, and we're focusing on indications. For now, it's for foot and ankle. For example, Achilles tendon and Achilles sleeve avulsions. And in the future, we're targeting more ligaments and limbs tendon diseases, for example, ACL tear and meniscus tear, and also rotator cuff. So those are really common sports injuries as well as aging injuries that we are targeting in the future. And the market size for US is 5 billion, and in Japan, it's 1.2 billion. Our team compile of talented scientists, researchers, surgeons, engineers, and marketing personnel. And also we're collaborating with multiple clinical and hospital and also manufacturer companies. And our market strategies, including collaborating with the hospital, including Tsuchi Hospital, Boston Affiliate Hospital, to conduct marketing driven data, and also promote our products in the international foot and ankle affair. And as well as our exit plan is to work on M&A with big orthopedics manufacturing companies. Our company is founded in this year, and we have already filed 2 PCT patents, and we are estimated to establish our mode within this year, and then we'll be able to submit our TFDA and FDA approval by 2023. This round, we're raising 1.1 million for our pre-8 rounds, working on FDA and TFDA application productions, personnel expand promotion, and intelligent IP protection as well as RD. So we are Astron Medtech. We're seeking for angel fund for market initiations and seeking for hospital partnership in Japan. Thank you so much. I'm Ben, and we're Astron Medtech.
Next, Hughes Biotechnology.
Good afternoon, ladies and gentlemen. Thank you all for being here. I'm Anthony Wong, the Business Development Director of Hughes Biotechnology from Taiwan. We think this will be the really good opportunity for us to share our innovative technology and have invaluable comments from here. Hughes Biotech is a company specialized in providing next-generation functional ingredients by our unique proprietary biomethod called RenoSorb, which is for greatly enhancing the aqueous solubility and bioavailability of plant-based active ingredients. First of all, I would like to talk about some problems of these kind of materials. Most of the plant-based functional ingredients are secondary metabolites, such as isoflavone from soybeans, aspartame from citrus, curcumin from turmeric, resveratrol from grapeseed, and so on. Based on scientific research, they all confer remarkable health benefits to humans, such as antioxidation, anti-aging, anti-cancer, anti-obesity, cardiovascular protection, and several specific bioactivity. However, most of them share the same challenge for introducing into dietary supplement products, which refer to low water solubility and low bioavailability. Low water solubility makes them become limited in flexibility in product type, which means they can only be processed into pill forms such as tablets and capsules. Low bioavailability results in insignificant health benefits in humans. So here is a statistics. 84% of dietary supplement companies have noticed the pill fatigue phenomenon, which means consumers are feeling sick and tired of taking pills every day. Consumers, to a great extent, prefer more conventional platform to take dietary supplements. They don't want to be treated like patients. On the other hand, there are 67% of consumers have ever doubted that the efficacy of dietary supplement products are quite as pronounced. Plant-based functional ingredients are poor absorbed, by which may lead to doubtful health benefits. More importantly, because of the poor absorption, many plant-based dietary supplement products are recommended taking multiple times a day. This can also be annoying to consumers. So here is our solution, the RenoSorb technology. It is an established bioprocessing platform. It's capable to renovate native plant-based nutraceutical into mobilized form, which means it is highly aqueous-soluble and bioavailable. Provide product with high purity. It is an eco-friendly process, and most importantly, we use only food-grade component in this process. So why RenoSorb technology is such unique and take advantage of current technology? Because this process utilizes functional group rather than excipients for nanoparticle technology. As we mentioned before, some dietary supplement companies start to deal with the problem of plant-based functional ingredients. Most of them use formulation technology, which means they have to add a lot of excipients and resulted in products with low purities and can only be water dispersible. Taking dietary supplement is about a long-term consumption. It is inappropriate for consumers to take those excipient for such a long period. In addition, water dispersible products are insufficient to deal with the requirement of some dietary supplement products such as effervescence tablets and functional drinks. So RenoSorb technology may have great potential in this aspect. So we utilize RenoSorb technology to reinforce soy isoflavone into renoflavone, which is the first commercial product of our company. Renoflavone could have improved bioavailability from isoflavone about 4 times. Also, it is reported to be more efficient to prevent the postmenopausal osteoporosis by the improved bone mineral density and elasticity through our scientific publication. As we can see, the CT tomography show a better femur trabecular bone microarchitecture of experiment animal with ranolflavone than those of placebo group. Also, our second product is ranolcidine, which is made from aspartame, an emergent functional ingredient with multiple functions such as anti-cancer, anti-obesity, cardiovascular protection, and circulation improvement. Ranolcidine is more bioavailable than did the commercial aspartame and existed water-soluble aspartame, which rebel about 6 times higher bioavailability than the commercial product. Also, we can see in the photograph, ranolcidine is totally water-soluble, which is capable to form transparent solution, whereas the native aspartame can only be dispersible in water. We have successfully launched 3 products, ranolflavone, ranolcidine, and in addition, ranolsage. The latter is aqua-soluble luteolin, which exhibit neuroprotection and chemoprevention activity. And our pipeline candidates also include curcumin, silymarin, rutin, sesomol, and resveratrol. So through Renosorb technology, we can have functional ingredients with better health benefits, which make the dietary supplement product really works. And we can provide possibility for insoluble functional ingredients to incorporate into aqueous formulated product. Also, we can provide functional ingredients with which require low daily dose to provide health benefits. Products from Renosorb technology are flexible to incorporate into liquid forms of dietary supplement products, such as powdered beverage and effervescent tablets. And if we process them into pill forms, we can also have boosted health benefits. And here's some scientific publication and patents of our core technology and the applications of our products. We at Hughes believe that our innovative technology is a breakthrough, and our assets are perfectly aligned with the rising trend toward broadly using more nature ingredients to address healthcare's needs. We are now actively seeking appropriate partners to distribute our existing product and commercialize our laboratory products internationally, and also looking for co-development opportunities with them. We believe that our assets would complement or drive growth for your portfolio business, and we sincerely invite you to learn more detailed about our company. Finally, we can make those functional ingredients to be better, and we can make the world better. Thank you very much.
Next, CellEnvision.
Hi everyone, thanks for watching my pitch video at today's International Matchmaking Conference for startups, investors, and industry to join together sharing the information. And I'm Dr. Rex, as the founder, CEO, and CTO of CellEnvision. I would like to show you our business. Simply to say, we provide you a patient driver organized single-cell platform for your precision medicine applications. And this PDO single-cell platform could be applied to 3 different fields of single-cell multiomics, non-invasive prenatal testing, and last one of the immunotherapy cell-based liquid biopsy. And core technology we create is a loss-free isolation methods with single-cell sorting system for rare cell capture and keep membranes function integrity. So when we are talking about today's topic, we want to focus on how our technology can apply on the NIPT. The keep the membrane function integrity is quite important because we want the whole genome DNA will be locked in the fetal cells. So our core technology can solve a clinical or mathematical need when we're talking about how to reduce the risk of invasive prenatal testing. As we know, the amniocentesis will cause 0.3% risk of abortion. So here we using the FNRBC NIPT methods to provide like us a needleless amniocentesis by simple blood testing to using circulating fetal RBC cells instead of amniotic fluid cells. And when we using the FNRBC NIPT methods compared to the 2 regular prenatal testing methods, the first one is cell-free fetal DNA, or the other one is the amniotic fluid cells detected by CGH microarray, and we all can got the extremely high sensitivity, large 99%, and we can implement this method at the earliest weeks from the 8 weeks. It is even earlier than cfDNA 10 weeks. And more important is a whole genome DNA in the FNRBC. We could use it to detect the chromosome abnormality and single gene mutation of the baby defect gene problems. So when we're talking about how to customize perfect baby, that will be start from 2 sides to do the sampling. The first side is will isolate the FNRBC from the maternal blood, and the second is doing the embryo biopsy to pick up the one our side in 100 cells of embryo. So it's a quite a tough task. How you can keep the all functions integrity of the oxide. So our spatial spec can solve those kind of problems. And why you should trust us? Because our pilot production machine with IEC 61010 certification and our functional validation testing are validated by Taiwan Spark program. The last reason is we are clinical trial feasibilities ongoing with our collaboration hospital. The one is the Taipei Medical University Hospital, and the other one is the Hsinchu Makai Memorial Hospital. And this slide shows our workflow of core technology that could be clear to separate 2 parts. The top part is talking about how we smear all the blood cells, the PBMC cells in a normal layer on the bottom of our cell assembly cell array chip by the gravity. And the bottom side talking about we has image scanner with 3D precision stage, and the function can image screening and precision of the FNRBC. And whole process take only 2 hours for examining 4 milliliters white blood cells. And the sensitivity can reach 1/10 to power of 8 using the integrated microfluid chip and automatic image scanning system. And how we verify how we the FNRBC we capture are all come from the child, all come from the baby. We take the paternity testing is called the STR, short term repeats, and that's because every child has a pair of STR DNA fragment, one inherent from the mother side and the other one inherent from the father side. So in paternity testing, we compare with the DNA typing of the child and the mother to find the STR DNA fragment to make sure the DNA are come from the baby. And in this slide, we show 3 different case STR results to as the evidence we exactly can find the FNRBC cell and all come from the baby. And how the size, how large is the size of marketing of the prenatal and newborn genomic testing market? It is 2 billion from 2019 and grows up to 6 billion by 2027. And here we want to emphasize the first tier marketing we want to cut in is in Japan, because the number of pregnancy older age 35 is around 270K is quite large groups all over the world. And the more important reason is there are no health insurance to cover the pregnancy. Women can take the treatment of amniocentesis or take the testing of CGH microarray. So that's why we want to bring our technology into Japan marketing and cut into the marketing, occupy some marketing size in Japan. And compared to other product has been launched all over the world, most of them are focused on the cancer tumor applications for the cancer circulating cancer tumor cells enumeration or cancer cell CDC enrichment. But only 2 machines announced they have the they have the purification function both of CDC and FNRBC. And our machine, general one type of machine, are 3-in-1, 3 function achievement can compete all the others products. And what's our strategy go to the marketing? We will build our 5 demo centers in 2 years. And the first one will in Taiwan Tsinghua University. And our business is sharing the profit with LDD labs company all over the world. Then we provide operation training, machine, and maintaining. Then they do the NIPD outsourcing from the clinical side, and then generate the analytical report to clinical side. And we do get some income from in last half years. From last year September to this year March, and for the machine rental we generate 50K, and for the consumable like a microfluid chip service fee we generate 50K USD dollars, and we are team consists of 3 functions and 5 staffs, And we right now we are want to get a seed fund around 3 million and plan to exit in 5 years up to 150 millions. And thanks for your listening. If you are interested in knowing the detail of our business, welcome to contact us by the information list on the slide. Thank you very much.
Thank you so much for attending the Taiwan Smart Health Innovation Day. We will send a B2B matchmaking questionnaire. Please fill out the questionnaire for a follow-up one-on-one meeting arrangement. Thank you again for your time. I wish you a joyful evening.